See, my dear friends and colleagues, distinguished guests, ladies and gentlemen, good afternoon. It's really a pleasure to be with you this afternoon. And first, I want to congratulate AMREF and all of you for a very excellent conference. Allow me just to talk about three things. I'm sure you've had a lot of problems, and perhaps some of the presenters did highlight some of the challenges in the health system across Africa. But I'm sure in the middle of all that, we are meeting now in an environment where we are also talking about successes across the region, isn't it? Whether you're looking at whatever health indicators, whether you're looking at child mortality, kids are dying less than they did a decade ago. Women are surviving pregnancy and childbirth more than they did before, isn't it? We have more money going to the health sector. We know life expectancy is changing. So I'm sure we have a lot to celebrate despite the challenges that we have. That's my message, really. And perhaps more important, in 2017, we have more political leaders who have taken health as an important issue on the political agenda. Certainly here in Kenya we have, and I'm sure this story that is repeated across the region. Others have gone to the extent of putting the legal framework expected in the country, where you anchor health within the Constitution. Here in Kenya, under the Bill of Rights, health is a right, because we could talk about Article 43. Health is a right, so it's anchored in the Constitution, the highest legal instrument in the country, and I'm sure that is repeated in several countries. And I'm happy we, as government and partners, we're investing to actualize those rights. And that story is repeated across Africa, particularly on the issue of maternal child health. I've also had the privilege of working in several African countries. And one of the most humbling things is to go to some of the countries in Africa, in villages, and find a new mind shift of our people. In the poorest region of Mozambique, I met families that are trying to explain to me in local language of how they see health as a source of wealth. It's very easy for elites to conceptualize that, but a villager may not see health as a key source of wealth and also their own welfare, isn't it? So that is changing, and that can be repeated across Africa and where you come from. People are starting seeing health as a very fundamental piece of their life, and they're investing in that, from the highest wealth content to the lowest as well. We're happy about that. I've seen transformation where communities have changed the political dialogue and the mind shift around the issue of life and death. For a long time, we used to say death is the will of God, or Allah, isn't it? But that has changed. Do you know that? People are getting really annoyed when children die. People are really getting annoyed when women die. They engage in their political class when people die. They now know they're dying because somebody has failed. Within the community, with the political class, whatever, they know, and they're demanding those rights. In where I work, in my position, I have this privilege of being challenged wherever I go. People asking very difficult questions. Very difficult question. And I was at Pain last Saturday in a place called Lamu. Lamu is towards the Somali border, in a community dialogue session. How I was trying to explain to them, they were asking me, why are doctors on strike? Do you know how much we are offering to pay a doctor in Kenya? Somebody who finished school last week, $2,000. As an intern. Yeah. So for those who find that appetizing, please come and work. Okay? $2,000 is mind-boggling for them. They didn't understand why for 90 days the doctors are not working for them, despite these good offers. It was a rather difficult conversation. We also bordered the issue of professional ethics, whether they have a right as well. It was a very difficult conversation, but it is a very also enlightening for me. It means that the Kenyans of today are not the Kenyans of yesterday. So their whole social transformation. And we talk about shared prosperity. It's about that. People see have a stake in this government and this society. I know you heard more about investment in health systems, human resources, commodity management, but I'm sure you also heard around about innovations in Africa. Let me just figure out perhaps 3. Use of technology. I'm sure you heard stories of how we're using technology for education and increase access to education. Use of technology to educate community health workers. Use of technology to manage medical records, isn't it? So some of our countries, remember the infrastructure for M&E, monitoring and evaluation, was post-independence, paper-based. We have more diseases, more people, but some countries are still there, but we have already adopted technology. I'm happy to see a number of African countries have harnessed technology. We have harnessed technology in how, to improve quality of care. We have harnessed technology to monitor care and so on. So there's a lot of innovation in Africa, and I'm sure you heard all about all that. We have also heard, I'm sure, about then you thinking about universal health coverage and how we are going to we are doing risk pooling. We ensure that every African has access to affordable quality health care. And that's a dream for our leaders. I'm happy when I go to African Union, I hear every president talking about it and so on. And people actually doing something about it. I'm sure you had, your mother have had a story about Ghana, isn't it? And what they're doing, Kenya, other countries, how we are doing to improve access to health insurance as part of our journey towards universal health coverage. I know we have access programs, whether by HIV, TB, malaria, or, for example, in Kenya, we have a free maternity program every year. And tremendously, we have changed how women give birth in this country. 3 years ago, only 40% of our children are born in hospitals. We are now close to 70% of those children being born in hospitals. The significant thing we removed was financial barrier. And now, because we cannot tell an African in 2017, she doesn't know the value of delivering in a health facility. That's not true. Most of them have 8 years of education plus, so they know the value. The problem is the distance, and the problem is the financial barriers that come along. And all that has been addressed, and that story can be repeated across the region. We also have, I'm sure we have had good stories about public-private partnerships in many aspects of it, whether it's increasing access to care, harnessing the power of private sector, or whether we are harnessing the power of private sector to execute certain programs. For example, in Kenya, we partner with big companies like General Electric, Mindry, and other international companies, in exactly 1 year to ensure 100 hospitals across the country have top-of-the-range medical equipment. In exactly 100 days, I saw the wonders of private sector. Had we done the same way, it would have taken us 10 years to reach the same goal. So there are a lot of good things we can talk about across Africa. Lastly, I just want to say that Africa is rising. Do you know that? Do you know that? Clap for you so you know that Africa is rising. And therefore be part of the change that is coming along the way. We have great ideas from this workshop. The biggest problem is always execution of this thing. So that's the biggest challenge for all of you as you go home. The great ideas I've had, see how you can transform some of them. Viva Africa. Thank you so much.